Good afternoon, everyone, and good afternoon, Minnesota. Thank you for joining us today. This will be our regular COVID-19 update. Commissioner Malcolm is here to give a health update, but I'm also joined today. We will have Lieutenant Governor Flanagan join us via video. We have Attorney General Ellison with us, and Department of Public Safety Commissioner John Harrington are with us to provide remarks on the tragic events in Minneapolis. When I was with you Saturday, I closed by wishing everyone a peaceful Memorial Day as we remembered those who have died in service to our country. Unfortunately, Memorial Day evening in Minneapolis was anything but peaceful, and neither was last night. Like so many Minnesotans and so many people now across the country and the world, I was shocked and horrified by the video of George Floyd's death. It's very clear to anyone that what happened to George Floyd is wrong. The lack of humanity in the video, as I said, made me physically ill and even more difficult to understand. So I want to be very clear. My heart aches for Mr. Floyd's family and friends. Gwen and I express our deepest sympathies to those who knew and loved Mr. Floyd. I can never know what you're experiencing right now. I can only imagine that the loss and the enormous hole in your life is unbearable. I know our communities are hurting, especially our black community. And you want to see action, to seek justice, and take steps to prevent this senseless tragedy from happening to anyone else. I was glad to see the Minneapolis Police Department took quick action and removed the officers involved from their positions. But this is not the end of the story as we seek justice for George Floyd. Over the last few days, I've been in contact with Minneapolis Mayor Jacob Frey, and this morning I spoke with Hennepin County Commissioner Mike Freeman. Both have promised swift action once the facts of the investigation come in, and I will work with them to ensure that's exactly what happens. Our community has a right to expect an independent, thorough, and prompt investigation by the Minnesota Bureau of Criminal Apprehension, who will present its findings without recommendation to the Hennepin County Attorney's Office. Attorney Mike Freeman has said his team will review the findings, determine how to proceed in an expeditious manner. I also look forward to the findings of a federal civil rights investigation that will now be conducted by the FBI. We all know that these types of incidents disproportionately affect our black and brown community members. I also strongly support the rights of those to peacefully protest. It's how people express their pain, process tragedy, and work to create change. I was saddened to see that some of the protesters were in harm's way last night, and I just want to encourage everyone to be safe, especially in light of the COVID-19 pandemic, and thank the protesters for their commitment to safely protest during this pandemic. To all of those of you who are in pain, to those who are angry, to those who are afraid, I not only see you, I hear you, and I stand with you. We will get answers. We will seek justice. George Floyd didn't deserve to die, but George Floyd does deserve justice. Now, as many of you know, out of abundance of caution, Lieutenant Governor and I have not been at events together for the past 3 months. Avoiding the chance of both of us being exposed to COVID-19 has meant that the Lieutenant Governor is working remotely with us every day. But before I turn it over to her, I think for many of you who know the Lieutenant Governor's work of decades of working on equity and justice issues, she's an important voice for all of us, and I'm just proud that she is helping us work through this tragic situation, trying to make sure that we do everything in our power to make sure that that fair, thorough, and fast investigation is done to move this process of justice forward. And with that, I would turn it over to Lieutenant Governor Peggy Flanagan.
Thank you so much, Governor. I'm grateful to be able to join you in this way today. My deepest sympathies to all of George Floyd's family and friends. I'm so deeply sorry for your loss. My heart breaks for Minneapolis, for St. Louis Park, the community that I call home and that George Floyd called home, and for Minnesota. I'm also outraged that Minnesotans, especially Black Minnesotans and Black Americans, are experiencing the collective trauma of a Black man dying at the hands of law enforcement once again. George Floyd should be alive today. We are pursuing answers through state and federal investigations, but one thing is very clear to me. The complete lack of humanity in the video of George's death is horrifying. We will get answers and we will seek justice. It goes without saying that no one should be treated differently by law enforcement due to the color of their skin, and no one should live in fear of law enforcement because of the color of their skin. The grief in this moment is unbearable. But in this moment of pandemic, it's more than that. Because the truth is that the same underlying issues of systematic racism that led to the death of George Floyd are the same underlying issues that have led to communities of color, especially our Black community, to be affected more by COVID-19 than the rest of the state. We have to continue to protect each other and ensure that all Minnesotans, particularly in communities of color and Indigenous communities, are healthy and safe. During times of grief and anger, our instinct is to run to each other, to come together and to hold one another. But the way that we love our communities most fully is to protect one another. Last night, we saw those choose to express their grief and their anger through protest wearing masks, distancing themselves from others as best they could. I thank the demonstrators for the measures and their commitment to safely protest during the pandemic at a time when nothing feels normal. As a light-skinned Native American woman, I am grappling with my own responsibility to push back against anti-Blackness in my own community and in the systems in which I work every day. This is the work. Someday, when it's safe, we will all have the option of going back to normal. But we must not let that happen. Normal, quote unquote, means that Black and brown bodies are not safe. Normal was not working for us. We cannot get back to normal. We must get back to better. The governor and I will continue to fight for answers and for justice for George Floyd, his family, and for Minnesota. Thank you.
Attorney General Ellison.
Governor, Lieutenant Governor, let me join you in just acknowledging that George Floyd was a man who was loved by some. He was a person who had every reason to look forward to his life. He was a person who worked and made a contribution to his community and his family. It was particularly touching to hear his employers talking about how much they loved him and what a contribution he made to their establishment. He was somebody, and his life mattered, and he was an important person to many. And the fact that he is gone and the way that he was taken is deeply tragic on multiple levels. Allow me to just say that the investigation has started, both state and federal. If you have information, we need you to come forward and share it. It is very important that the investigation is thorough, is fair, and is just. And I will say that I will be, and my office will be, a force for transparency, accountability, and justice. We will call it out when we see otherwise, and we will foster it every opportunity we get. This means that at this point, that this investigation must proceed with a degree of objectivity. We're not going to prejudge the facts, though the video is so clear before our eyes. Why? Because at the end of this process, we want nobody to be able to question the process. And whatever the consequences may be, they will be just, they will be fair, and they will be what the law requires. Let me say also that it is important to understand that this tragic event that took the life of George Floyd is a point in time and an incident involving a person. But the reason that there's so much outrage connected to it is because it is part of a larger pattern, as the Lieutenant Governor mentioned. We could talk about Jamar Clark or Philando Castile, but we can go all the way back to Rodney King. We can go back to my city that I grew up in Detroit, Michigan. I remember very clearly as a 5-year-old, tanks rolling down the street because of the riots that were sparked by unfortunate incident between police and African-American community members. But my father would tell us, well, you don't remember, son, the 1943 riot. 68 riot wasn't the first one. There was others, all along similar patterns. And that's why when the Kerner Commission report came out in the mid-1960s after these civil disturbances, they said that the spark of all this was bad police-community relations. Now, bad housing, unemployment, and a whole range of other social problems really built the tension, but it was the incidents that occurred between the police and community that sparked it and caused tremendous problems. So what we're dealing with is not an isolated case. We're dealing with a systemic problem. And the investigation and the prosecution, if that happens, and the ultimate consequences, they are being handled. I'm confident that they're being handled competently. But that doesn't end it. The discharge of the officers doesn't end it. The criminal process that has begun doesn't end it. The civil rights process doesn't end it. We've got to have permanent, deep, systemic change, which is why myself and Commissioner Harrington, who you'll hear from in a moment, led an effort, the working group Police Involved Deadly Force Encounters, which we issued in February 2020. This report lays out a series of recommendations that we arrived at with our group, which included law enforcement, community, civil rights, people from diverse ethnic backgrounds, many people throughout the state. We went to Cloquet, we went to Bemidji, we went to St. Paul, we went all over the state to talk and to listen to people. And so I think it is a good time for us to understand that this report was always a working report, was always a report designed to solve a systemic problem. And I urge us to really reflect upon the recommendations in this report, because at some moment, sadly, George Floyd will be laid to rest. At some moment, the process, the criminal and civil rights process, will be concluded. But will we have made any real substantive changes, or will we just be setting ourselves up for it to happen all over again? So I just want to say that the recommendations in this report are critical. I urge people to reflect and look on this so that we can begin to really, really make the changes that this state deserves. I will mention that under Pillar 4, Policy and Legal Implications, 4.2 suggests that we adopt use of force standards that make sanctity of life a core organizational value and include requirements for de-escalation, reasonable, necessary, and proportionate use of force, duty to intervene, which means if you're an officer, you can't stand around and say, well, he did it. That wasn't me. And use of sound tactics and reporting unreasonable use of force. And so I just want to conclude here and just say deep sympathy to the family of George Floyd. I want to urge people who want to demonstrate to use proper protocols for safety. We are still in the middle of a pandemic, and it is important that you exercise your First Amendment rights safely, and I urge you to do so. So with that, I'll conclude here. I'll be available for questions, but Commissioner Harrington.
Good afternoon. I'm John Harrington, the Commissioner of the Department of Public Safety, and I want to echo this sentiments of sympathy to the family and friends and the Minneapolis community on the passing of George Floyd. I was alerted to this incident by the BCA. Superintendent Drew Evans called me to let me know that Minneapolis had what they believe might be an officer-involved death. Not an officer-involved shooting, but a death that was part of a police use of force. The BCA, as the state investigative agency, moved quickly to take over that crime scene and to begin the criminal investigation. As part of that process, they reached out to the Hennepin County Attorney's Office, Mike Freeman, and in particular to Amy Sweezy, who has been the lead prosecutor in the past cases with Hennepin County. They began the process of gathering information, working with the medical examiner, working with the Minneapolis Police Department, and in conversations with Chief Madero Arredondo, it was decided that a civil rights violation really did appear to be occurring on that screen, as that footage that has revolted so terribly many people. Chief Arredondo then contacted the FBI, and the new SAC, Special Agent in Charge, Rainier Droschlager, agreed to take on the case as a civil rights or a color of law investigation. And Superintendent Evans and SAC Droschlager are conducting this investigation as a joint investigation. They are doing a parallel investigation, but the impetus behind this has been that we will do an expeditious investigation. We will make sure that this is not an investigation that lags. But just as important as it being expeditious, because we know the public and the community and all of you want to know what happened that fateful day, it will be an investigation that's done right. This will not be an investigation where we're going to cut any corners, where we're going to miss any T's to be crossed or I's to be dotted. We are going to make sure that this investigation is done properly so that when we go to trial, if we go to trial, when we present this case to the Hennepin County Attorney's Office for prosecution, and when the FBI presents this case to the U.S. Attorney for prosecution, that all of the facts necessary for a charge will be there. One of the things that we need right now from the public is witnesses. And that is one of the things that the public can do right now to help expedite this investigation, is to contact the Bureau of Criminal Apprehension. And if you were there, or if you took video of what was there, if you know people that were there, we want to hear from you, because the sooner that we can get all of the witnesses and get their statements, the sooner we can move this case along. We do have to wait for certain factual pieces of the process. The medical examiner has not yet done an autopsy. We do not have results from that yet, and we will have to wait for that, because that is a crucial piece of information in any murder or death investigation. But we want to be able to do everything else that we have in our power to move this case along as quickly and as expeditiously as we possibly can. I want to thank Attorney General Ellison. He and I took a journey over the last year to Minnesota to try and discuss this, what would happen. We talked about this as being deadly force encounters. We talked about it, and people criticized us initially about the fact that it should have been just officer-involved shootings. And unfortunately, this is exactly the kind of scenario that we talked about, as to why we talked about and why we brought the focus to being a deadly force encounter and not just an officer-involved shooting. This case reminds me so terribly of the Eric Garner case in New York. But I can promise you that unlike the Eric Garner case, which waited years for action, much as Chief Arredondo took swift action on the employment of the 4 Minneapolis officers, you will not have to wait. There will not be a lag in time for the investigation by the BCA to be presented to the Hennepin County Attorney's Office. And I expect that you can expect to see progress made regularly. The last piece that I will note, and I appreciate once again the Attorney General bringing up the work we've done on the working group, is there is so much pain in the community. The video from last night was just an example of that pain being expressed, the trauma being expressed. And one of those recommendations we talked about is, how do we heal community? We spent one entire session just talking about healing the wounds that community has when someone that they love, someone they treasure, someone that they value is ripped from them in a deadly force encounter. And so I will encourage all of us, state and county and local levels, to think about how do we help our communities heal? How do we empower those in the community that can bring us together? And how do we patch over the wounds that George Floyd's passing has opened? At this time, I will turn this back over to Governor Tim Walz to continue the briefing.
Well, thank you, Commissioner. I want to state, just as a Minnesotan first, how incredibly grateful I am to have these three public servants. The words coming from the Lieutenant Governor and understanding the depth of this. Attorney General Ellison's work goes back decades. I witnessed it as a colleague in Congress working on civil rights issues and ways to make our communities whole and safe. And then a privilege of having John Harrington and a long history of working in community and seeing law enforcement from many different sides. And I too want to express, back into my role as governor and statutory requirements, my responsibility over Department of Public Safety and the BCA is to echo what Commissioner Harrington said, is to ensure an accurate, fair, and expeditious process around the facts of this case. And I'd want to acknowledge too what I think each of them hit on. Watching any of the video of what happened to George Floyd, and then watching citizens come out last night, I too share that urge of just a primal scream of when you watch humanity get erased in front of you. It is almost inexplicable how you respond. I want to be incredibly careful that anything I say from this office does not jeopardize a fair journey towards justice. So while my personal emotions are real and I'll validate them, I also trust that our system of justice is predicated on exactly that, a fairness for everybody involved, a true look at all of the facts involved, and then the expectation that those facts will be acted upon to provide justice for everyone involved. So we will take questions on this, but I want to do just a quick brief update before we go to Jan Malcolm on this. I think most of you know we crossed that threshold in this country of 100,000 Americans have died now in the last 3 months. We in Minnesota are, I stood here about 3 weeks ago with you and I said what's so frustrating and terrifying about this is, as long as we continued where we were at and kept the pace of where we were going at, I said I will stand in front of you on about the 28th or 29th of May and we will have crossed 1,000. That was the day we had crossed 500. That pace is relatively stable, which is terrifying as is somewhat of good news. But what we're finding is a better understanding of COVID and the spread in our communities. I want to thank the Minnesota National Guard, and we'll continue to use them. We tested over 10,000 people at 6 locations on the weekend, a holiday weekend, and this was no barriers. Come in, there was no payment, there was no anything. You came in, you got it, and you got your results back. We're going to continue to do those types of things. We're going to continue to target the areas from congregate care living facilities to communities that are underserved in this, because once again, Lieutenant Governor was speaking truth in this, that COVID-19 is disproportionately impacting communities of color, and the black community is showing up in that, both from a health perspective and from an economic perspective. We're also seeing in places across the country that an undertesting in those communities is leading to the lack of understanding how it's spreading. We can't allow it to happen in Minnesota. Finally, I signed an executive order today that outlines phase 2 of the Stay Safe Minnesota plan. As announced last Wednesday, the next phases in Stay Safe include a cautious strategic turn of the dial, outdoor dining at restaurants and bars to start June 1st, where the number of customers at any one time is limited, and for the physical distance of 6 feet can be maintained. Also, personal services like salons and barbershops can open June 1st at 25% capacity to ensure that the safety of both employees and customers inside. Campgrounds will be opening and organized youth sports programs will be operating without competitive games, but getting back in the rhythm. We're trying to strike that proper balance. There's nothing healthier than having folks, young kids involved in the summer with those types of activities. It's not just the physical and the mental health, it's the memories that make summer so great, and we're trying our best to strike that proper balance. Again, when people keep keep asking me what's the difference from one place to another. We've distilled it down. There's a lot of things, but the three things that Commissioner Malcolm and everyone across the country that are in this say, it's first how close you are to another person, second how long you're in close proximity to that person, and third how predictable the setting is, coming, moving, going, yelling, whatever it might be. Those are things that you can, that the lens that we're looking through. Rising cases in Minnesota, although we're still, I think, at 16 days. Jan will update us on that, at doubling. Those areas of caution where we're at, we have 2 areas of the state where we're kind of in the yellow on ICU bed capacity, those types of things. But overall, we are maintaining, and again, we're getting, I think, as more data comes in, maybe being able to tell, is this a plateau or is it a calm before the storm? All of the modeling, both internally, externally, and from partners that we work with, seems to still show that the peak is still a ways off, but there is a degree of uncertainty that comes in that prediction, and how we're acting in terms of masks, in terms of social distancing, in terms of staying home if you're sick, that will have an impact on it. So with that, I will have Commissioner Malcolm give us a quick update, and then we will be open for questions on all the subjects. So, Commissioner.
Thank you, Governor. I'll be really brief today, and it is something to note that we're here talking about the daily COVID briefing, but in the context of a much larger picture of health in our community and what creates health and what threatens health. And I so appreciate the comments of Governor, Lieutenant Governor, our Attorney General, my colleague, Commissioner Harrington, about kind of drawing the connections between these issues and the fact that the conditions in our community that put some people at greater harm, at greater risk than others, is the challenge that we all face together. And as both the Lieutenant Governor and the Governor have just reiterated today, that does show up in our data about who's getting exposed to COVID, who's getting seriously ill, who's getting hospitalized. And as the Governor just pointed out, nationally, the lack of proportionate testing in the communities that are at greatest risk, I think, is clouding our picture nationally of where the risks are and where the interventions need to be concentrated. So I appreciate, though I'm very also heartsick about the context of today's discussion, and my sincere condolences as well. So as the Governor mentioned, we crossed a major milestone during the day today of over 100,000 United States deaths, 1.7 million cases, again, stunning speed of spread of COVID-19 across our country in just the last few months. Globally, 5.6 million cases and 350,000 deaths. Again, just a breathtaking speed of the impact of this pandemic around the globe. As the Governor mentioned, yesterday we added an additional 500 laboratory-confirmed cases to our total, bringing Minnesota now to 22,464 cases. It was on a testing volume that for a Tuesday was quite high, over 6,600 tests, partly because of the community-based testing that the Governor mentioned. And again, just deep, deep thanks to the National Guard and so many people in local public health and across state agencies that helped to make that happen. And thank you to the Minnesotans who came out, stood in long lines, and clearly expressed their desire for more access to testing. Sadly, we also are reporting an additional 33 deaths among Minnesotans, among our family and neighbors from COVID-19. That is that is tied for the daily high total of mortality, matching last Friday's total also of 33 deaths that day. 16 of these deaths were in Hennepin County, 6 in Dakota, 5 in Ramsey, 3 in Anoka, 1 each in Nicollet, Nobles, and Washington counties. The demographics: 2 people above the age of 100, 9 in their 90s, 11 in their 80s, 6 in their 70s, 4 in their 60s, and 1 person in their 30s without any known underlying health conditions at this point. There are 598 people currently in the hospital, 260 of those in intensive care units, which is the highest daily total to date. But as the Governor has mentioned, and I've mentioned in prior days' briefings, All of the data indicators are mixed. We see relative stability in the growth pattern, a moderate rate of growth toward what we still expect to be the peak later in June or even into July. But we do see some more accelerating and concerning signs, like the rate of increase in ICU capacity, even though we have planned for this and have surge capacity available in the state. The fact that a couple of our hospitals have already gone into that surge space at this point in the curve is important to note and gives us reason to be really, really watching these data. And as the governor indicated, some of the dial-back criteria that we've talked about, the doubling time in terms of cases looks good. The healthcare capacity is kind of still within the range that we projected, but is yellow in some areas. But the rate of hospital admissions is particularly on a rolling average in the more recent time period is something that we're watching really closely. So with that, I will turn it back to the governor and be available for questions if you have any.
Great.
Thank you.
Thank you, Commissioner Malcolm. At this time, I think all of us would be, and I will make sure that the Attorney General and Commissioner Harrington are available for questions. So please go ahead to the press.
Governor, let me start to you and to the Attorney General. The Mayor of Minneapolis, Jacob Fry, has called for the one officer who had his knee on George Floyd's neck to be charged criminally. Do you, Attorney General, do you, Governor, agree with that? Should he be charged?
I think, and I would answer to this, and I want to be, as I prefaced a little earlier, be very clear about the position I'm in to not either taint or influence how this comes out, because our justice system's pretty clear. We will get the evidence. We will present that. The charging authority is Hennepin County Attorney Mike Freeman. We spoke with him today to ensure and reassure him that we are doing everything we can in a professional, expeditious manner, and to reassure the public that that's going to happen. So I think that is the proper way to go. That is the thing in the position that I'm in that I will advocate for.
I'll just say that we have a normal course of criminal prosecution, which starts with a fact-based investigation and then an evaluation of whether criminal statutes democratically passed have been violated. And that is the procedure we should follow. I understand the emotions are running high, and I think it's important for the mayor to channel the emotion of the people who he represents. But I think it is critical that we adhere very closely to the facts and the law and the normal process. And so that's what I'm supporting, and that's what I believe we should do.
Follow to both of you. Protesters are back out at 38th in Chicago and at the 3rd Precinct right now. They have gathered for a second straight day. What is the state, if anything, doing to make sure that the unrest does not get to the point of last night?
Well, I think first of all, and you've seen me stand in front of here and say that I will do everything in my power to protect the people who are protesting against me or something that I have. I think this is a fundamental right they have. I think, as I said, that primal sense of outrage that folks are feeling, there's a sense in doing this. I would encourage them to do so with a mask, to socially distance. We certainly don't want to see things turn violent in any way, but I also think this is a pretty normal response where people are giving, and I think what we need to see is I saw folks out there from across the community with baby carriages and things expressing what all of us saw in a video, and I simply think that that's a proper way to approach this, and we will do everything we can to keep things as safe as possible. We want the normal business to be able to go on, but we certainly believe that there's a right that people have to gather.
I was specifically talking about the clash between police and protesters last night. Protesters were throwing rocks at police cars and at the 3rd Precinct.
Yeah,
police
certainly
were
we don't.
firing back with chemical
Yeah,
gas.
we're not condoning that, and I would say we need to do everything we can to de-escalate that situation. I think if folks are given the chance to gather, at least, I mean, what I'm seeing on that is that they want to express in community their outrage. I don't think they're there to engage in the violence or to have that, and I think we need to be smart to make sure we don't set up situations that cause those clashes. Attorney General.
Yeah, what I will say is I would urge law enforcement to exercise restraint restraint is the better part of valor, they say. And you're dealing with people who are hurt, who have been through a lot, and this is not the first similar kind of incident, and they're outraged. So I would urge restraint. I also would urge protesters to remember that they are there to lift up the memory and get justice for Mr. Floyd. And so they should conduct themselves in a way that will enhance that and not distract attention away from what happened to Mr. Floyd, but would keep the attention focused on what happened to Mr. Floyd. And, letting your emotions override, you in a way that would cause the conversation to shift to, crowd behavior isn't a wise way to handle this. And it certainly is not a way to make sure that Mr. Floyd remains central. And so that would be my recommendation.
Dana?
Commissioner Malcolm, can you talk a little bit about the public health concerns surrounding these large gatherings, and also the police using chemical irritants, forcing folks to cough during a pandemic?
Well, I just will briefly reiterate what the governor and the attorney general have both said about the importance of awareness of the context of that we're in, of the very, very real risks of that the pandemic poses to not only the people who are protesting, but as we know, the importance of the degree of community spread that we have today. Not only puts the protesters personally at risk, but the larger community as well. So, just again, a plea for people to be careful and to be mindful of those health guidelines and the importance of distancing and masking. And certainly in terms of correct police procedures, I leave that to the experts and my colleagues. But of course, anything that serves to further exacerbate respiratory illnesses when we're dealing with a virus that is about that is certainly something to be watched. So I would again be a reason why people. Certainly nobody who's ill should be out protesting, I hope, and people who may be vulnerable to the virus.
Governor, regarding your June 1st order, a lot of restaurant owners are saying that it's kind of untenable for them. Either they, A, don't have outdoor patio space to use, or B, what happens when it rains? This is Minnesota, it's the summer. What are they going to do with their patrons in the rain? Can they come in and use the restroom? Can they come in and shelter for a storm if it passes through? Are there any chances, is there a chance that you could amend that order again to allow at least some indoor dining?
Well, and I think as Commissioner Malcolm said this, I want to be very clear. We have been very cognizant of the pain it's causing economically, and I think it's falling heavily on restaurants and the hospitality industry. We're not closing them to cause them the pain. We're closing them to stop the spread of COVID-19 and to not overwhelm our hospitals. With that being said, I go back to those 3 points. Setting at a table, eating, talking to friends for an hour and a half in a smaller place poses one of the bigger risks. What we did was, and I want to be very clear, it's not as if we thought that the fix would be opening to outside dining. Activities outside are much safer. There are many facilities, or at least some, that have the capacity to do that, and we're encouraging communities to figure out creative ways, and MnDOT's working with them to open up streets. We're also not naive to that it's going to rain, and it was 47 degrees yesterday in Duluth. It's not going to be the fix. It's meant to be a portion or a potential if some try and go there. Also, we did write into the executive order the very scenario that you thought about. We can't think of every scenario, but we're not going to tell people it starts to pour out of nowhere or there's a tornado warning like last night. They can certainly shelter from that. So we want people to make the common sense decisions. And I think what I keep people get frustrated it's not moving fast enough. One of the things in turning that dial is there's a lag time between when we turn the dial, when people come out, and if we start to see it. And I think we're trying to see if what we did here a couple weeks ago when we started retail back, when we started more things happening, are we seeing a surge? Is that adding more cases? So I don't think you'll see it by June 1st, but I had an extensive call with the hospitality industry. They were spectacular, and I want to just call it out again. When they're expressing their frustrations or ideas of trying to open, that is collaborating with us trying to get there. And so we are in close collaboration with them. We're talking about it. That is the next step on the dial, obviously, to open up some of these places. We're talking to them and talking to health about what makes sense. They would tell you opening up at 25% internally because they're different from other businesses. They have a certain staff, no matter if you have 50% or 25%, you still have the same amount of staff. So it won't happen before June 1st, but what I tell them is we're taking very seriously what the next step of that is. We're using the data the best that we can. We're trying to accommodate. And I would tell Minnesotans again, for every one of these things we put out, there's 1,000 exceptions to the rule. To use common sense, to mask up, we're certainly not trying to put people in a bad position. I am seeing places like Stillwater, I think, are being very creative with their main street. They're basically turning it into an area where they can open up some of these. But again, it was never meant to make people whole. It was one step in the direction.
Governor, you said you signed the executive order today on the outdoor dining. It was announced last week. In that week, a number of restaurants and other places were urging you to loosen restrictions. Did you change anything from the way you announced it last week to what you signed today?
I don't believe so. In terms, I think some of it is just some of these details about what happens as we were talking more with them. But I've had extensive conversations. I was on with numerous groups on several occasions as they were expressing what we could do. Their passion inspires me. I mean, these are entrepreneurs. We didn't change anything at this point, but I think our whole goal is what you've seen, that we have been moving this dial. We announce it ahead of time. We put the things in place. We do it, and then we immediately start on what the next one's going to look like. And I think we've got a jump start on that. And I think the thing that this is both frustrating, and I wanted to be clear to folks that we're having the data help us drive these decisions. We didn't put a date and say, we're not going to do anything till June 15th. We did not say that. Now, from a health perspective, they may say you should put a gap in between there to see if you're getting people sick from these outdoor situations or whatever you're doing. But I think as this situation evolves, as we have more data, we were very purposeful about that to tell them after June 1st, we're prepared to look at what this next steps looks like. So that's what's happening right now. That's what we talked to them about.
Any timeline for what the next?
No, I don't think so. And again, I wished it, and this is, in any business, predictability is the number one thing you want. COVID-19 is predictable in some ways, and in other ways it's very much not. And that's where we're at. But we're starting to get a data set, and again, I wish I could see it. I keep asking and pushing hard, are we at a plateau or is this an anomaly? What's going to go further? And when we look at, and fascinating chart and putting me in front, when they run these models, they run them 10,000 times. And we've now collated all of those of 4 major models with 10,000 runs each into a picture of all the lines and what they look like to try and get a better idea on that. In most of those, it still looks like we're on the front end of that. But again, depending on how well we have social distanced, how well we are doing the things necessary, we may see a front end on that. And that will, of course, impact when we start to make a change. Because again, if we were past the peak and on the other side, these decisions would be easier to make. We're not there yet.
Along those lines, Governor, but, we've got a lot of questions from sports about, is there still a chance we're going to see professional sports in Minnesota this summer? What would have to happen for that to become a reality? You see some of these leagues are gearing up for something, but we don't know if that's even a moot point or not.
No, and I spoke with Major League Baseball Commissioner Manfred a while back, talking about the things that needed to be in place. I will have to be candid in that we were talking about the health side of things, what the broadcast would look like, what the cleaning crew would look like, on that. But I remember thinking at the time, I think one of the holdups here is probably going to be labor relations for this, and it seemed like there were more complexities. It's certainly my goal. These are important parts of who Minnesota is. And I think just like all these businesses, if there's a plan to do it, I certainly think it's going to, again, in the short term, it's not going to be with spectators, but just like today, I listened to folks out there. We opened up racing without spectators. So from horse racing to stock car racing to motorcycle racing, some of these things. And those of you up north in Brainerd area, you know how important this is. And I think we're trying to learn from them. We're seeing things that are put out there between the professional sports, NCAA, and some of these others, what we're seeing with NASCAR was able to do. I think there's a potential that that's how we're trying to move. So I think if it's possible, and I know that NHL is looking, and they're looking at Minnesota being one of their sites for their 2014 playoff. We certainly want to be a part of that and work with them. And if it's at all possible, and again, this will be health helping with them, how the teams are going to live together, what it would look like to put two teams in target field, how they've thought a lot about this. The broadcast would be remote from one site. It would go to both teams' broadcasters outside the facility. I mean, they put thought into it, and that's what we're working with them to get going. So I think there's a potential there that we can do that.
A couple questions from my colleagues. First, for Commissioner Harrington, can you assure Minnesotans that the BCA will deliver a fair investigation?
Yes, I can. I have just the absolute bedrock trust in the process that Drew Evans and his team at the BCA is working through. Not only do I have faith in that, but in the last year, as part of the working group, we had outside experts review the process that the BCA uses, and they validated that we are doing it the right way. That does not presuppose what the outcome will be, but it does, in my mind, guarantee that the process that we're undertaking, it will be factually, it will be objective, it will be lawful, and that we will produce a honest report to the prosecuting attorney so that they can make a good decision about criminal charging.
And a question for the Attorney General. Are you convinced the FBI investigation will be handled fairly under Attorney General Barr?
I have trust that the FBI takes its work seriously. They have experience in this area. I can also assure you that if we do see any evidence of a lack of fairness, that we'll raise those issues. So I know that so many people in the FBI, they're just people who are career. They're not part of a political cycle. Their job is to investigate, and I think they take that responsibility seriously. And I will also say that I've worked productively and constructively with U.S. Attorney Erica McDonald. I believe she is a person of integrity. And so despite some of the national prevailing winds, I think that we have every reason to trust that things will be conducted in a fair and upright way. And we'll be watching. We're not going to just say, yeah, it's going to be fine and walk away. We're going to say we believe it's going to be fine. And by the way, how's it going? And so we're going to trust and we're going to verify.
Commissioner Harrington, I also have a question from a colleague. Can you confirm that it was Officer Derek Chauvin who had his knee on the neck of Mr. Floyd?
I can't confirm. It's an open investigation at this time, so I can't give you any information about what's in the internal reports at this time.
Governor, questions, and Commissioner Malcolm, questions from colleagues here. Wondering if you are tracking any surge in cases among children or any outbreak in a child care center. Some reports of that.
Thank you.
We are indeed keeping close track of the demographic data about outbreaks. And yes, I'm sorry, Chris Ersman's not with us today. I don't have complete data on the specifics of a child care investigation, but I am aware that that is being investigated. Yes.
Can you just tell us, have the people affected, have the families, have they been notified? Do they know that their child may have been at an outbreak facility?
I apologize. I'll need to get back to you, and I will, right after this, about what the status of that investigation is.
Commissioner Malcolm, have you seen anything regarding asymptomatic testing? I know we talked a little bit about with the National Guard doing some of that. Have you seen any results coming from that give you any kind of thought moving forward?
We've not gotten a breakdown yet of the testing results from this weekend, but we are looking forward to that as a really helpful additional insight into what's happening with community spread. We have gotten some interesting data from health systems as they've begun to test patients coming in for other kinds of procedures. So we're getting a little bit more of a sense that is confirming that asymptomatic individuals can and are testing positive. So should have some data to share with you next week.
Thank you.
Commissioner Malcolm, while you're up there, we've heard a lot about long-term care facilities. Is it still considered wise for state health officials to allow the transfer of infected patients to those facilities?
That certainly is a question that a lot of people are asking, and as I think I mentioned on a call last week, that has been an affirmative part of our plan all along, was to get people out of the hospital as soon as they no longer need hospital level care for their own protection. Healthcare acquired infections are a real concern, as well as to free up acute care capacity. So that has been part of the plan. We have been working very hard with our long-term care facilities on their preparedness, their infection control plans. I will say that we think it's a good idea to kind of take stock of what we've learned. We're going to be having a conversation with stakeholders across multiple spectrums just to assess that. Certainly the governor and others have asked whether we should be looking at setting up some specific facilities to be able to take more of that. We're as I've mentioned earlier, each facility that has positive cases has a nurse case manager from the health department who works with that facility and who's very aware of the current status. So I think we're making careful decisions in that regard, but it is a fair question and something that we're going to be revisiting and having more conversations about.
I was on a governor call, and this is one that comes up a lot. I would note, and we talked about this, in so many of these things, there's folks that seem just so obvious where they'd be, but I think it's important to remember, these are folks that went to the hospital, they recovered, but they're still in that mode. They're going back to their home, and this is where they live. This is their place where they're at. This is that sense of normal. The rest of us, I think, so you self-isolate, but where are we going to put people and think about it? So this was federal guidance. This is what everyone was doing. This was not a mistake. This wasn't like no one thought about this. There was a complexity of how do you deal with this. And I think that issue of infections both in long-term care facilities, I always worked a lot with VA hospitals, but it's hospitals in general. If you are going to die in an American hospital, the number one thing that will kill you is hospital-acquired infections. Not what you went in there for, but getting an infection. That kills 90,000 people a year. So infection control, and I think one of the things is, and I applaud Commissioner Malcolm, the legislature, and our administration last year, as you knew, Minnesota was one of the last places that had any type of regulation over long-term care facilities. We were able to pass that. The problem is before we were able to implement all of those changes, COVID-19 came in. So I think it's a fair question. I think it's one, though, that there's a complexity around it, both the humanity of the people and this sense of spread. We're tracking it very closely. And I think, again, you recall when we were having the discussion early on about personal privacy or whether to put these, things out there, the names of these hospitals, I think we made the right decision on that. But it panics people. I mean, people say this, if it were you, would you put your mother in one of these places right now? And that's a question that we all are asking ourselves to get it. So I appreciate the question.
Commissioner Harrington, will the BCA release the body camera video of the Floyd case before the investigation is over? You do have the authority to do that.
I will have to talk to both the Henry County Attorney's Office because I know there has been concern in the past about releasing body cam video as it may prejudice public and prejudice a jury. So I would have to consult with the Hennepin County Attorney's Office before we did that. So that would be something that we have done before. But as I understand the rules and regulation around that, there is typically a tipping point that there is a public interest that is overriding the normal rules of criminal procedure of keeping evidence confidential until the case is presented.
You said an expeditious investigation. Are we talking weeks or months? Days.
I would say that we are probably talking weeks rather than months, but that is to say, I don't know where the investigation will lead. I do not have control over, for example, the medical examiner and the results that they will come back with. And there are some parts of the process that the BCA does have under their control, but there are parts that do not. And so we have to work with all of the systems that will provide evidence before we can present the case.
Just to confirm, no autopsy as of this moment right now.
I have not gotten autopsy results as of this time.
Commissioner Malcolm, to piggyback on the asymptomatic question before, another question from a colleague. Do you have any information about a long-term care facility where dozens of staff tested positive last week despite some having no apparent symptoms? And if you know about that, where did it take place and what's being done about it?
I do not know the specifics of what facility that might be. We are testing aggressively in long-term care facilities, and we've tested some 40 facilities, all staff and all residents, since the development of our 5-point plan. And we have many dozens of facilities scheduled for testing in the coming days and weeks. The goal, as you know, is to test every facility with any cases at all. So I do know that we've done a lot of testing and found places with more staff testing positive, even if they're asymptomatic, which is kind of what we feared, what we expected, frankly, and that does put additional pressure on the staffing challenges that many of these facilities already face. So we've been very busy trying to stand up staffing support to the facilities so that when we find a situation like that, we're able to help the facility continue to be able to provide care.
You said you tested 40. How many more are on the list to be done?
They will continue to be scheduled. I think we've got, I believe, 30 more scheduled for testing between this week and next, and that number changes each day. I think I mentioned that we created a survey tool so that facilities can ask to be tested. Now, many of them have relationships with healthcare systems, and they've already done some testing, not relying on the state's resources. And we're still trying to get our arms around those data, because we don't always get those reports. We get reports of positive cases, but we don't necessarily have the full data picture of places that have been tested and what the positivity rate was, because we don't have the denominator of the negatives.
Governor, a question from Bill Werner. Would you support allowing the state to take over the Minneapolis Police Department on an interim basis to ensure that all officers observe state human rights laws?
Well, I think Mayor Fry and his response on this and the police chief in Minneapolis, this is a direct responsibility to them. I know the community's frustration around this. I think at this time, as the Attorney General has clearly stated, we have a process in place. I think this report that was done is valuable. It's one of the things that we pushed. Two of our leading law enforcement folks in the state engaged numerous communities. But I think at this point in time, that deep dive that we're going to have, and I think people are out there, and I hear them saying it, we hear it every time, we need to improve police-community relations, and then the next one comes. It sure seems like COVID-19 has given us the opportunity, as Lieutenant Governor said, to not go back to a place of normal. But at this point in time, there's so many complexities in this. That's not what we're focusing on. We're focusing in the short term on certainly justice in the case for George Floyd, and then the implementation of some of these suggestions. And a lot of hard work went into this, and I know there's community folks that were out in California sharing some of this over the weekend with folks out there, because this is unfortunately not just a Minneapolis or a Minnesota issue. This is nationwide.
Oh, I'm sorry. Attorney General Ellison, you mentioned a number of things earlier that you would like policy changes done,
Right.
such as officers having to step in when they see, an overwhelming use of force that's above and beyond. To be clear, are you calling on legislators to take action here, or would all of these changes that you want to see come from police departments themselves?
Well, if you look at this report, and I'm happy to provide you a copy of it, there is plenty for a number of areas of authority to weigh in. The legislature certainly one. Administrative offices are others. The Attorney General has some things to do. Police departments have some things to do. Community has some things to do. And so it is really a multi-factor approach that we're recommending. Some of it involves care and well-being of officers themselves who are under high-stress situations. We know that they need to constantly work on themselves being able to get back out there and deal with stressful situation after stressful situation. But it also is community healing, as the governor has talked about, and a range of things. I mean, I think Commissioner Harrington has already implemented some things he has power to do, like establishment of a liaison for families involved in deadly force encounters. And so it really is a number of things. Let me just say this. This is an acute, specific incident that's horrible and tragic, and it must be dealt with on its own weight and no shortcuts in dealing with this. We don't want to jump over this incident to get to the deep and underlying solutions, but we must get to the underlying solutions, or we will be right back here in fairly short time. We've got to deal with these problems. We've got to literally shift policing. And I'll just say this as I turn it over to my friend. We had people assist us on this task force who actually assisted President Obama on 21st century policing. So there has been an acknowledgement, even from Washington, that the way we do policing needs to move from one century into the one we're in now. It has to be more transparent, more accountable, more community-based, more just. It has to factor in things like the sanctity of life, which is very important consideration. There was I think it was Camden County, is it? Camden County Police Department had a very high, serious problem with deadly force encounters with police. They implemented, along with the sanctity of life protocol and use of video as a simulator to train with, and other things as well. And they reduced it near to zero. And so you can solve this problem. It is not a problem that cannot be solved, but mostly it takes will. And I believe between the governor, commissioner, lieutenant governor, and my office, and others, and the legislature, we could do it.
Well, thank you all. I would thank you, Attorney General. And again, speaking to you as Minnesotans, and especially in the community, your anguish is real. The sense of anger, disillusionment, all of those emotions that are out there. Certainly encourage you to express those in a healthy way, and if that's together, do so with the social distancing in place. But I can tell you the trauma that these situations bring up, and it's widespread, but it gets very specific for some people. I've had the privilege of becoming friends with Valerie Castile over the last several years, and I spoke to her, a mother whose heart was broken yesterday. But those of you who know Valerie, she's a force of nature, and this is someone who turned that pain and worked on these types of issues. She talked about training issues. She talks about that shared humanity, but she's also a very spiritual woman. And I think in talking to her yesterday, it lifted me up. She said now is the time, especially in COVID-19, the time of this, seek justice, get this right, but reach out in a way as, again, when we're looking for that comfort, now is the time we want to be around people, we want to share. But she's talking too about reaching out to others, show that sense of kindness, show that sense of who we are. The world's watching. The world is watching Minnesota right now. We need to be honest about who we are. We need to be honest about our strength, and we need to be honest about our weaknesses. And that's why this report and this work was done. That's why all of us are trying to pledge never again. And it's on us again. And my commitment as governor is to make sure the BCA provides an accurate accounting of the evidence, provides that forward, and puts that on the Hennepin County Attorney's desk to move forward. And in the meantime, to look at those systemic issues of inequities and continue to try and work on them. The Attorney General's right. This is a point in time, a horrific point in time. It's our responsibility to deal with this one, but also deal with that broader issue. So I thank you, Minnesotans, and we will follow up tomorrow. Thank you, Attorney General.
Thank you, sir.
Commissioners Malcolm and Harrington, thank you.
Find more local news stories at ccxmedia.org and follow us on social media.